Should a cervical kyphosis always be corrected? That's one of the questions I got asked in the comments sections under a video of mine that I talked about cervical kyphosis. And it's a great question. I'm going to dive right into it. In fact, I have 18 bullet points to go over. So stay tuned. If you've been diagnosed with a cervical kyphosis, this is going to be a very, very important video for you. Hi there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what our office offers is corrective care, non-surgical, non-operative methods of correcting and treating spinal conditions like cervical kyphosis, amongst many others. And one of the main techniques I use is called chiropractic biophysics, which I've talked about a lot in many of my other videos. In this video, what I want to go over is 18 bullet points that I basically came up with to answer the question, should a cervical kyphosis be even treated? So let's get right into it. So if you've seen many of my other videos about cervical kyphosis, you'll know what that is. And if you've been diagnosed with one, I'm thinking you may have seen your x-ray. If not, you should take a look at your image. But here's what a model of the spine is with a normal cervical curve. You'll see that the cervical lordosis is a segment, a geometric shape or a segment of a circle. That's the normal alignment of the cervical spine. And the kyphosis would be an actual reversal of that to some degree. Okay, so it'd be in the opposite direction. There's a flexion forward, neck curvature, and normal lordosis is an extension, circular bending back curvature, which is normal, and a kyphosis is abnormal. So that's just to summarize what a kyphosis looks like. So in short, a kyphosis should be corrected as long as the patient qualifies for care. We need to do an examination, a spinal assessment, rule out any contraindications, things like ligament instabilities, dislocations, fractures, tumors, canal stenosis, things that would be contraindicated to corrective care, obviously. But if the person qualifies for care and for corrective care, the aim should be to stabilize at bare minimum and even correct to some degree, whatever the limitations allow, that cervical kyphosis. So that's the short answer, yes. Now, it doesn't mean that you're always going to get a full correction. In some cases, you get some stability. In some cases, you get some correction, which I'll talk a bit more when I go down the bullet list over here, okay? Now, why would it be beneficial for a patient to get that cervical kyphosis reduced? Okay, well, there's many reasons which I'll talk about, but there was some research that came out that showed that patients that had a cervical kyphosis, they were more likely to be part of a pain group inside the study. So they looked at a bunch of patients and they x-rayed, they had x-rays of their cervical spine, and then they looked at their clinical condition, and the ones that had cervical kyphosis were 18 times more likely to be in the pain group of that study, okay? Which means that there's 18 times more likely to suffer of neck pain because of cervical kyphosis, and then the related conditions with that, which is any disability related to neck pain, things like disc degeneration, numbness and tingling into the fingers, poor quality of life related to that, poor mobility of the neck, aches, pains, muscle tensions, anything related to disability around the neck. So just because of that, that should be a bare minimum reason why cervical kyphosis should be corrected and why it even should be treated. So with many of my patients that had cervical kyphosis, we apply corrective care techniques, chiropractic biophysics techniques to traction their spine and adjust their spine in the mirror image position of their kyphosis. And I have many videos that show that. I'll link them in the description below and also at the end of this video where you can watch that. And the benefits that they receive from that is reduction in pain, improved mobility, less tension on the muscles, if they have radicular symptoms or numbness and tingling into the fingers, less numbness, tingling, or resolution of the numbness and tingling in their hands and fingers, and generally an overall improved quality of life. Many people tell me they sleep better, they have more energy, and just overall feel better because that cervical kyphosis, which is causing a tremendous amount of stress and discomfort and tension on the spine, has improved. So like I mentioned earlier, the normal configuration of the neck should be a circular shape geometrically, right? So an actual kyphosis is abnormal. It's just not normal. It's not genetic. It's not hereditary. You're not born with it. In fact, if you look at ultrasound textbooks where they've ultrasounded infants or babies in the womb still in utero, they'll look at the spine. You can see some of the spine development at certain stages of development. You'll see that there's an actual lordosis in the fetus before the baby's even born. So we know that there should be a natural lordosis of the cervical spine at birth. So if there's a lack of that lordosis, a reversal of any kind, the kyphosis, it's abnormal. It's just not normal, okay? And that alone, again, should be another reason why a cervical kyphosis should be corrected towards normal or as close as possible, try to stabilize. Another thing to understand is that because now the neck is in an abnormal kyphotic position, now the loads and the weight distribution from the head down due to gravity is acting in an abnormal way on the actual anterior elements of the spine. So that's the vertebral bodies and the discs. So normally there should be a lordosis, and the weight of the head, so it's anywhere from 10 to 15 pounds depending on the person's height and weight. So the weight of the head is going to be loaded on the posterior elements, which are the articular pillars here, which are very strong and dense and firm. But if the neck is in a kyphosis position, the vertebral bodies are more porous, they're not as strong as the articular pillars, and then the discs are now abnormally compressed. So these abnormal loads, due to the effects of gravity over time, will have to adapt, and they maladapt, and they begin to form degenerative arthritis, spinal arthritis, and also degenerative disc disease. Okay, so if we look over here, okay, so a normal cervical spine should be circular in shape. This green line represents a normal lordosis. Okay, now these are not kyphosis configurations, but the same concept applies. When the spine begins to lose its configuration and decrease that lordosis and eventually goes into kyphosis, if it does, this spinal arthritis and degenerative disc disease will eventually accumulate over years. Okay, so it's an accumulative process. It's a maladaptation to the abnormal loads on the spine. So that alone can cause neck pains and disabilities, disc degeneration, nerve irritation, and cause all sorts of pains and symptoms just because of that. So again, that should be another reason why a cervical kyphosis should be worked on and corrected. Now, another thing to consider, which is not often talked about, that's certainly not going to be mentioned in your reports, is this. So again, look at the normal alignment of the spine. So normal should be a circular shape, right? An extension, lordosis, right? Comparison here, lordosis on the x-ray. When the spine shifts into an anterior position, so a straight military neck or a kyphosis, there's now abnormal tension on the spinal cord. And this was demonstrated by a well-renowned neurosurgeon many years ago, where he had groundbreaking research. His name is Dr. Alf Brieg, and what he showed in cadaver studies, when he tensioned and stretched the spinal column in a forward position, it actually stretched and tensioned and caused tensile stress on the actual spinal cord. Now, if you look over here, okay, this is a nerve chart. Here's the brain, your master control system in your entire body. Your body cannot function at all without proper brain function. So the brain sends all its nerve energy and nerve power through the brainstem and then the spinal cord. So the first part of the spinal cord is in the cervical spine. And look at all the organ systems it attaches to: heart, lungs, stomach, liver, all the way down to the colon, through the vagus nerve over here. And all the messages from the brain have to go through the neck as a bridge to get to the rest of the part of the body. So it's a super important area. So there's many neurologic consequences for that mechanical cord tension, as Dr. Alf Brieg called it, when there's a kyphosis here, okay? So that alone should be another indication for getting this corrected, the kyphosis. And the last thing I want to mention is that yes, the outcome of the corrective care should be to improve the neck towards its normal position, but there's always going to be limitation to that. Some of the limitations is going to be, spinal degenerative disc disease, spinal arthritis, fibrosis, scar tissue. Those things will be basically physical limitations to getting this corrected. That shows a chronicity of the problem, right? So the longer the problem's been there, the more difficult it's going to be to correct. If there's a ligament laxity, ligament instability, again, that may cause some limitation in correction. And then there's things like morphological reasons that may limit the correction. There's a relationship between T1, okay, so T1 up here in the manubrium sternum. There's a morphologic correlation between the angles of this point to this point that can actually correlate with the cervical spine. So based on that, you may not get a full deep neck curve correction. Nonetheless, if there's a kyphosis, you want to at least stabilize it or reduce it as best as possible. And I've seen in my office patients that have cervical kyphosis, we've reduced it even by a few degrees, and it's made a dramatic difference in their life in terms of relieving their pains and symptoms and improving their overall quality of life. So essentially, to conclude, yes, the cervical kyphosis should be worked on and corrected as long as the patient qualifies for care. How do you know if the patient qualifies for care? There's going to be a consultation, a history, a case review of all the medical reports and MRI reports. I take x-rays of my patient, full spine x-rays, frontal and lateral, and rule out any of the contraindications I talked about earlier, and then create a care program that includes chiropractic adjustments in the office, corrective care mirror image adjustments, corrective care exercises, and then corrective care traction, home exercises, and in-office corrective care structural traction as well. Okay, there you have it. So cervical kyphosis definitely should be worked on. And if you're wondering what to do if you have a cervical kyphosis and you're looking for a corrective care chiropractor, I can even help you find one. Just comment below and say you want to find a corrective care chiropractor trained in chiropractic biophysics, and I'll just basically reply back with a link to the corrective care chiropractic biophysics doctor directory, and hopefully you can find one in your city. There's many in the United States, several around Canada, and also in Europe and other parts of the world. So hopefully that will help you. Hope you enjoyed this. And if you want to continue learning about cervical kyphosis, how to actually treat it with corrective care, with adjustments, exercises, home traction, and office traction, go watch the video right here, right now to get the full tutorial on that.